welcome to our very special show, Health and Wellness, Myths and Facts. I'm Ambika Sinkama. We've been dealing with the global pandemic since March 2020, and it's had an impact on every aspect of our life. Pandemic has affected every part of the world, physically, emotionally, and financially. The pandemic has brought about new challenges and feelings of uncertainty for everyone. Mental health has long been recognized as a crucial factor in physical well-being, a fact that has become starkly apparent during the pandemic. Stress, isolation and uncertainty can exacerbate anxiety and depression in people with chronic illnesses like diabetes, cardiovascular disease, leading to poor self-care and worsening health problems. Due to work-from-home culture, sleep rhythm has been severely affected as well. Stress and sleep deprivation has affected chronic metabolic conditions the most. Unfortunately, it is a topic which is not discussed very often. And then there are misconceptions and doubts about it. We have a panel of experts who will guide us regarding stress and its effect on heart health. If you have any questions you would like to ask them, please send them to us via WhatsApp. The number is +91 91 67 666 941. Yes, that is the number to send us your questions for our experts. Please also send in your name and your location. Let me introduce our guests. We have with us Dr. Amar Kumar Das, MD, AFMC Pune, PG London, MKCG Medical College, Berhampur. And we have with us Dr. Chaitanya Kumar, MD, DM Cardiology, Senior Consultant Cardiologist, Medicover Hospitals, Kurnool. Thank you so much, doctors, for joining us today. I would like to start with you first here, Dr. Das. It's a WhatsApp question from our viewer. Sandhya Gopi from New Delhi is asking, can COVID induce liver damage in type 2 diabetes patients?
Yes. COVID, generally it has been seen that 15 to 53% of the people, they have a mild transaminitis in the form of deranged LFT. The LFT is generally 2 to 3 times more as compared to the other individuals. So it can affect the liver function test, particularly in those patients who are diabetic. But diabetic per se has got more mortality, particularly in the patients, those who suffer from COVID, because of increased sugar levels. They suffer from more COVID illness, and the chances of getting liver failure is more common. And those patients with diabetes, they also have non-alcoholic steatohepatitis and NASH, so they are more prone to develop liver injury. Although this virus is a pneumotropic virus, but we have got also the cholangiocytes. They are in the liver, particularly in the liver, so they can also involve liver. The chances of liver injury is to the tune of 0.4%. It is not very high, but the patient who has got a fulminant hepatic condition or a cytokine storm or a sepsis-induced hepatitis, they are more prone to develop hepatitis, or the chances of death is much more. The reason being, COVID patients, they have decreased cell-mediated immunity. The chances of clearance of COVID infection is less, so the recovery is less, and this is the reason why we should also think of COVID illness. And second thing, the use of drugs in COVID, particularly the steroids and other immunomodulators, they can also affect liver.
Absolutely. I think that's really well explained. We have another WhatsApp question that's for you, Dr. Kumar. The question is from Richard Dean from Buckinghamshire, England. What is the incidence and treatment protocol for long COVID in India?
Long COVID, as such, is used to describe the signs and symptoms, usually which may last for few weeks or months after having a COVID. It may be a confirmed or a suspected COVID. And these symptoms, according to the literature, what we have seen is in India, it varies from 40 to 60% of the patients who have been contracted with COVID. As the age increases, the long COVID symptoms incidence is more in India. And these symptoms is also related to the severity of the disease. If the patient has been admitted to an ICU or he has been admitted to a hospital, the symptoms are much more in these patients. So the incidence of the symptoms is much more in these patients. And as such, the COVID, the long COVID is not infectious, means they are not contagious to the general public. So it doesn't mean that the long COVID patients are not infectious to the general public. And the symptoms of the long COVID commonly include extreme fatigability, breathlessness, sleeplessness, dizziness, joint pains, some chest tightness, and palpitations, tremors. So it can affect each and every organ of the body. It depends upon the individual to individual. And symptoms also varies from patient to patient. The duration of the symptoms varies from patient to patient, and it also depends upon the immunity levels of the individual patient. So you can't label the patient, particular patient will suffer from the symptoms particular duration. It may take as long as 12 weeks for some patients to recover from the long COVID symptoms.
Sure. Sure, I think that's really well explained what you're trying to say, that it's not really infectious at that point, and it can of course vary from person to person and also the time. Dr. Das, people living with type 1 or type 2 diabetes are at increased risk for depression, anxiety and eating disorders due to their constant worry of keeping their blood sugars and other health parameters within the control range. Is it true, and how can people with diabetes better, how can they manage constant stress better?
See, type 1 and type 2 diabetes associated with mental illness is very, very common. And as in our country, it is less discussed. There is a term called diabetic distress. If you see, diabetic distress, particularly in diabetic patients, almost to the tune of 18 to 45%. And it is more common in type 2 diabetes. So if you see diabetic distress, these patients, they are mostly worrying about their disease, their ailment, their sugar levels, their HbA1c level, whether they are going to die. So there is nobody to take care of them. So it's a very big issue. It has to be seen. Second thing, depression and diabetes is very common. 1 in 4 will have depression. Whereas clinical depression, if you want to compare, 1 in 8 will have clinical depression. And the elderly population, they have more of cognitive or behavioral dysfunction. That has to be also seen because they require more of the psychiatric evaluation, and cognitive behavioral evaluation is much more required. And those patients, those who have diabetes, they have something called diabetes. So they have got obesity plus diabetes. So these people, they develop very problems with eating disorders. So how they develop eating disorders? Because once they have diabetes, they most of the time they have got the diet is not good, their lifestyles are not good. As the diet and lifestyle are not good, they also develop overeating, overhunger, and they have got fat and high carbohydrate craving is there. So they are more prone to develop more obesity, more diabetes. So there is a vicious cycle. Once there is a vicious cycle, they suffer from more ailments, and the complications of diabetes, particularly neuropathy, cardiopathy, nephropathy, everything affects. So we must see in a holistic and a individualistic approach to a patient, and so that we can treat the disease, both mental disorder as well as the physical disorder in the form of diabetes.
Absolutely. I think key here is to break the vicious cycle, either way, whether it's the holistic way, like you rightly said, Dr. Das. Moving on, Dr. Kumar, we have been seeing healthy and fit individuals pass away with sudden heart attacks. Can stress be one of the hidden causes of a heart attack? What is your view on this?
We know stress is now present in everyone's part of life. See, during the COVID also we have both financial stress and what will be our future, and even we have stress about our life also. So stress can be a contributory factor apart from the other risk factors for heart attacks like smoking or a diabetes or a hypertension. All these are responsible for the heart attacks, and stress which could add upon the incidence of the heart attacks to be much more.
Okay, so
whenever there is a stress, it may be a long-term stress or a short-term stress. So these patients, what happens is they cause the blood pressure to increase, or they can increase the glucose levels in the body, and this can trigger the plaque rupture in the heart vessels, which will lead to clot formation in the heart vessels and leads to heart attacks.
Okay.
So
it is really important to, control stress at whatever level, however one can do it, whether it's, through meditation, whether it's to a walk, or however one has to control stress. And like you rightly said, it can lead to other issues, hypertension, and also raising the glucose levels as well. Dr. Das, tell us, can sleep problems or a sleep disorder increase the risk of developing type 2 diabetes? And what are some of the common complications of long-term diabetes?
The sleep disorders and diabetes, they are mutually co-existent. You see, 1/3 of our diabetic patients, they have got sleep disorders. Particularly, they have got insomnia. The insomnia can be because of they have got more of nocturia, because they have high sugar, they have to go for frequent urination. They have got nocturnal hypoglycemia because our insulin level goes up and there is a stomach effect, so it can result in nocturnal hypoglycemia. And patients with diabetes, they have more of neuropathic. They have got more pain, aches over their legs. And some of the patients, they have got also restless leg syndrome. So as a result of this is a complicated thing. Because of this, they have and their stress, anxiety, everything which in turn decreases their sleep, and sleep is deprived. So we have to think, we have to treat them with proper advice of sleep hygiene. The other is medications and cognitive behavioral therapy. And the second question about the long-term complications of diabetes, see, the most important thing is the cardiovascular mortality. 70% of our patients, they die because of a heart attack. And the second issue is diabetic nephropathy or diabetic, this second killer of diabetic patients. So they are more prone to cerebrovascular accidents, they are more prone to infections, they are more prone to psychological abnormalities, they are more prone to various hepatopathy, so many, because it is a slow poison and it can kill the patient very slowly. And even we have got diabetic complications in the form of the diabetic ketoacidosis.
Yeah.
So we have to treat the complications. If we want to treat the patient, we have to think in terms of treating the patient in an individual approach by diet, by lifestyle, exercise and medicines, and most important is follow-up. So,
absolutely. I think treating the patient like you said, individual plans and all the things what you said, and besides that, of course, right sleep and also keeping stress away. So on that note, we're going to be taking a really short break. We'll be right back. Welcome back. You're watching Health and Wellness Myths versus Facts. Dr. Kumar, tell us, recovering from surgery can take time and may involve some discomfort. Many people react positively as they feel encouraged that they are on the way, of recovering and feeling better very soon. Sometimes, however, depression can develop due to certain restrictions that they advise post-surgery. How can one really manage stress and rehabilitation post-surgery?
Yes, whenever the patient have a major surgery like a cardiac surgery or a orthopedic surgery or a oncology surgery, so these will be the patients suffering from a lot of disability post-operatively, and it will take some time for them to recover. All is needed is a little bit of empathy on the side of the doctor towards the patient, spending time with the patient, and building up the confidence in him. By giving proper suggestions like diet and regarding the diet and proper sleep and pain relief to the patient, and preparation prior to the surgery, which is frequently missed by the doctors, especially if it is a very big surgery and the patient is having a post-operative pain and all those things, which needs to be taken care of. And after the surgery also, patients should be educated about the breathing exercises and proper exercises once they are ambulatory, and proper diet and meditation, which is helpful to the patient, so that and building up the confidence in the patient towards the progressive recovery later on.
So educating the person even before the surgery to really know what they're going into, and also after, and of course care, what you said is really, really important by the family members and the patient really knowing what they're going through. Dr. Das, what is the role of exercise in stress management, and which exercises are safe for people with diabetes?
See, exercise and stress. Exercise is very important for stress management. You all know stress can be because of the work-related stress, spouse-related stress, negative stress, job stress, various other stress, illness stress, various kind of stress that is going to hamper in our day-to-day life. So it has been seen that if suppose somebody has got the healthy practice of healthy exercise means minimum 20 to 30 minutes of moderate exercise for 3 to 4 days a week, or minimum 1.5 hours a week. It has been seen that it increases the muscle mass, it increases the peripheral utilization of glucose and decreases the lipid levels, it increases the happy hormones. So as a result of which, exercise will definitely decrease the HbA1c level, sugar levels, and mental well-being of the patient, and in turn decrease the insulin level in the patients. So we have, and second thing, the old people, those who are suffering from diabetes and various other illness, they can also use various yoga, meditation, because they can't do the aerobic exercises because of their age and because of the ailment. At least they can do yoga, meditation, and preventing the ailment is very important by avoiding the unhealthy life practices, particularly desk-bound job. Second thing, use of mobile and telephones on a regular basis, on social media platform, sitting mode. So all these things one must avoid. Avoid junk eating. So all these things will decrease the lifestyle. We can do lifestyle modifications.
Absolutely.
So we can do cycling, swimming, various other activities we have.
Absolutely.
So if
I think that's a really important point, Dr. Das, which you said, that of course exercise we know is key, whether it's for physical as well as mental well-being. But what you said, even if somebody cannot do vigorous exercise or walk for 45 minutes, for the elderly especially, they could either be doing yoga or some sort of meditation as well. So that's a very important point. Dr. Kumar, some people turn to food to comfort themselves when they are under stress, especially during the lockdown. People have experienced it. Why does stress cause people to overeat? And sometimes we also call it binge eating.
Yes, stress will cause overeating. So what happens is whenever there is a stress, people try to eat the junk foods and all those things, and this will lead to increase in the levels of the dopamine in the brain. So this dopamine is actually, it will relax the brain. So this overeating, why it develops is people try to satisfy their brain. The dopamine levels, more dopamine levels are required to satisfy the brain once they start eating, and it keeps on recurring so that the receptors will down-regulate in the brain, and this overeating will be a habit for the people who are facing the stress. And this is especially noticed during this COVID period, where people are they are jobless, and there are a lot of financial stress, mental stress is there, and they tend to overeat, and this leads to a lot of complications like, again, obesity, hypertension, diabetes. All these things are because of the overeating. So there are ways of stopping it is using mint in between the overeating to stop the overeating, and using hot tea so that you will stop eating. Or better is keep the junk foods out of your house. That is the safest way of avoiding this overeating.
I think those are some important points, like how one can really beat. I mean, basically one has to really avoid stress so that you avoid overeating. And the best thing, what you said, keep away from junk foods, don't keep it in your house. Moving on, Dr. Das, we're talking about stress. So tell us, can stress cause obesity, further making diabetes management even more complicated?
Yes, stress increases the chances of obesity. Obesity increases the chance of getting more stress. So it has been seen that during our earlier time, we had the response of human response. Once a tiger comes, there is a fear and flight response. So because of that, the catecholamines, the cortisol, every hormone is increased to increase the glucose level in the body so that the individual can get away from the tiger. But now there is no tiger. We have got an unhealthy tiger, that is the stress. The stress is affecting in our day-to-day life, and it affects almost to the tune of 24 hours a day. So it increases the catecholamine levels. So once it increases the catecholamine levels, there is insulin resistance, and once there is insulin resistance, there is decreased utilization of glucose and the obesity increases. And the happy hormones are decreased. Once the happy hormones are decreased, there is binge eating is there. Eating disorders are more common. More of carbohydrate and lipid is being taken. Unhealthy lifestyle practices. This and plus increased hunger. So all these things cause more obesity. So obesity and stress has to go hand in hand. And if we can treat stress, then we can treat obesity, which in turn we can. It has been seen that if suppose the BMI is more than 35, the chance of getting diabetes is 58 times. If the BMI is more than 25, the chance of getting diabetes is 8 times. So if we have decreased obesity, then we can have decreased incidence of diabetes. So we have to do lifestyle measures to decrease obesity so that we have a stress-less lifestyle by doing various yoga, meditation, whatever we have. So we have to do that to decrease obesity and stress. So there is a term called diabesity. We all know the diabetic people, they have obesity. So we have to treat obesity, and we have to treat the patient, particularly the childhood. Obesity is a very common problem. Once the childhood, so we are seeing patients with less than 18 years of age suffering from type 2 diabetes. So we have to prevent.
And the key here, very rightly said Dr. Das and Dr. Kumar, that the key here is that they are all connected. I think you all have explained it really well. You know, it's all a circle. So one needs to manage stress. One needs, and all this also how obesity affects diabetes and a lot more complications. So thank you so much, Dr. Kumar, as well as Dr. Das, for sharing all your expertise with us. News will continue on the other side.